Well, I'm Caitlin Lackey. I'm a chiropractor by trade. I'm actually certified by the American Veterinary Chiropractic Association, so that in the state of Texas, I can provide animal adjustments with veterinary referral. That means that you sign a form from your vet, and then we go from there, and I'm basically a specialist. So what I do is I specialize in the musculoskeletal system and keeping it functioning and moving at 100%. So, canine hip dysplasia, you obviously know, is a deficit in proper motion and a deficit in proper formation of the joints. So, I'm going to use my model here. Basically, what hip dysplasia is a malformation of this hip as it articulates with the pelvis. Okay, the hip is made of two parts. First and foremost, there's a femur. It's a big old round part. And then there's also an acetabulum from the pelvis. And those join together to make the hip joint. Okay, and it has a free motion. It's a ball and socket joint. So if those parts don't come together correctly due to a congenital problem or maybe an obesity problem because you can't support the weight of that anymore, that's fairly common. It's usually due to this pelvis right here. The muscles aren't holding on correctly. This hip becomes out of socket, or this hip, the pelvis part, the acetabulum, is too flat, so this just slides around, or this femur head isn't shaped right, so it doesn't fit correctly. Those are the most common things that cause hip dysplasia to occur in the first place. Now, how do you know if your dog has hip dysplasia? Well, there's several signs and symptoms you can see. The most common is a change in behavior. They're lethargic. They don't do the things like they used to do. Maybe they have difficulty going from sitting to standing or laying down to standing. That's more common. They may have difficulty sitting. Maybe they sit with their legs off to the side. They puppy sit. Or sometimes when they're running or they're trying to go upstairs, they have difficulty. They kick their back legs out, or they walk crooked, or anything like that. I see ambling a lot too. They're not able to trot symmetrically because it hurts their hip to do a symmetrical gait. So moving forward, those are several of the things that pet owners mention to their vets when they go to receive a diagnosis. Now, when you take your animal to the vet and they're listening to you 99% of the time, hip dysplasia is made off of, history only. The vet will observe your animal, they'll take in a history, and they'll say, well, your pet likely has hip dysplasia. And then they'll move forward with some management, and then maybe next time you come in and you say, well, it's still not getting better with that management. Well, then they might proceed into an examination, usually more moderate, severe complaints. Basically what they'll do is they'll examine your animal, they'll look at gait, they'll hear your history, and most of the time they'll take your animal back, they'll give them a sedative, and they'll probably take some x-rays. X-rays are probably the best way to diagnose hip dysplasia. There's also an examination test that they do that's called Ortolani's, and pretty much what that is we do it in people too. What happens is they take your pet's hips and they spread them apart, okay, and open them up. So that way your pet's legs are just laying out to the side. And what that does is hip dysplasia, usually the femur is outside of the socket. And what that test does, it helps relocate that back into socket. And what that does is it's a painful click when that goes back in, and it grinds. And it's very painful to the pet, so most oftentimes they scream out, so hence the sedative, right? That is also a position they take x-rays in most of the time, and they will make that differential they'll make that diagnosis when they look at your x-ray. So when they're looking at the x-ray, they're looking for several things. First and foremost, they want to make sure everything's the right shape. They want to make sure that the pelvic acetabulum is the correct shape, nice and round. They want to make sure the femur is nice and round, so that way they fit together, obviously. The next thing they want to make sure is that all the space around is the same on all sides. So if it's too narrow on one side versus the other, that's something they look at. They also look for degenerative change in there. So if there's erosive changes to the joint, if there's inflammation, if there's subchondral cyst, or if there's bone spurs hanging out, those are things they'll look for as well. And they'll point those out to you. Your pet will also receive a score, a hip score, and you'll be usually sent that. It's usually most pet breeds get that, so that way they're cleared to breed, or for genetic testing or things like that. They want to make sure the hips are of a good standard, so that way they don't pass on bad genetics. And then moving forward, once you have a diagnosis, what's next, right? That's what most people ask me. Conservative management is great, but most of the time we move straight to palliative treatment. Palliative treatment is designed to make your pet feel better once they already have this condition. So palliative care most of the time is NSAIDs. This is your Rimadyl and things of that nature. What it's going to do is it's going to tell the body stop making inflammation, and that's not necessarily a good thing. Your inflammatory processes in your body exist for a reason, but what it tells the body is stop. So that way your pet doesn't sense those inflammatory molecules. That way the brain's not able to sense that it's in pain. So that way your pet appears better. There's also, your kidneys have to filter those out, so there can be, organ damage if this is a prolonged use. So you need to ask your vet if that's right for you. Meloxicam is also another fairly common one I see, Rimadyl and meloxicam. Now the next thing I usually see is the muscles that support the hip that are around it oftentimes will go into spasm. So when I'm assessing a pet, I see the psoas muscle, that's a hip flexor, and then the glutes, the muscle that was the big rump muscle, is going to be in spasm and have trigger points, and they're very painful when I palpate them. So most of the time you also get a muscle relaxer with your anti-inflammatory. And what that does is it tells the body, the muscles need to relax, so that way the muscle spasm doesn't cause pain. And, that has its ups and downs as well, because, those muscles are trying to hold everything together. But if you take muscle relaxers yourself, that it has some side effects. It can cause gastrointestinal upset. It can also, make you loopy or sleepy because it relaxes every muscle in your body, like your heart and your lungs and all the other stuff. Okay, so, that poses a problem. There's some more conservative things they do as well. I see some laser treatments. Laser treatment is, it's red light, and what it does is it goes down to the cellular level and it tells the cells to make more energy from the mitochondria, so that way the cell is better able to process and better able to heal with that energy. I also see things like acupuncture, which are great. They use needles or acupressure, which is touch of certain acupuncture points. And what that does is helps the flow of chi, from what I understand. And the chi is the body's way of flowing the hormones and the lymph and the blood. So that way it's better able to, move throughout the body. So that way, if blood flow is stagnant, then you can have a chance of that creating nasty stuff you don't want. You want to move blood flow in and out, so that way all the good stuff comes in and all the bad stuff comes out. I also see things like stem cell treatments, and what stem cell treatments is, what they do is they go in with a big old needle and they inject into the joint the new cells, so that way the new cells can turn into whatever they need to be, whether it be cartilage or bone or whatever it needs to be, so that way the hip has new joints, or new cells, that it can use. Unfortunately, this doesn't stop the already degenerative process that's already there 99% of the time, so this isn't a one and done fix. It's usually, okay, we need to do it again. There's other stuff. Most of the time, your vet's going to recommend surgery to you. And what surgery does is there's 3 different surgeries that can happen. And the most common for younger dogs that's recommended is a TPO, a triple pelvic osteotomy. And what that is they cut the pelvis in 3 places. What they do is they cut here, here, and here. This isn't anatomically correct, but they cut it in 3 places, and what that does, it helps open up the pelvis, so that way the hip can relocate back to where it needs to be, and then it can grow back to the position it's supposed to. This comes with brackets and screws, so unfortunately your pet has to be recommended cage rest and often steroids, so that way the body doesn't reject any of the extra parts that were put into the body. And cage rest, as you know, for puppies is really hard. So usually good success with this surgery, but you may proceed to the other ones if you have an older dog. So there could be something like a hip replacement, which is very common in people. They pretty much just put a metal part in there, and I see great success with that surgery. Unfortunately, if your pet rejects the metal, or there is a chance of infections because of the surgery, but usually pretty successful. And then the next one that I see most commonly is called an FHO, a femoral neck osteotomy, or FHO, and what they do is they basically, the femoral head, they just cut it off. So that way it's a stump as it articulates with the hip. So that way the problem can't reoccur. When in doubt, cut it out. And what this does is the body, it heals. It makes a big old scar tissue joint around that. And pretty much pets do great with it. It doesn't ever recur. There's no more painful relocation of that hip when they sit down. And pets do great with it. They usually don't have to have too much cage rest, so there is some rehabilitative therapy vets usually recommend for them. Now, conservatively, what we can do is what I do. I offer adjustments, and adjustments are supposed to be conservative, preventative, so that way we prevent this from ever becoming a problem in the first place. They can also be palliative, and they do offer natural pain relief. And what I do is I work on correcting the motion in the SI joints, the low back, and sometimes the hip and the knees. So that way we can work on the stabilizing the proper motion, gain that proper motion back, and that way we can also work on decreasing inflammation. If a joint is stuck in improper position or malaligned, it causes the muscles to go into spasm and for the body to create inflammatory molecules, so that way it's very, very painful. But if we correct proper motion in these joints, the pet's very able to move, they're better able to function, they're better able to heal because the problem's not there. Unfortunately, this is something we have to do on a fairly regular basis. It's not a one and done, but it's natural. We don't have any of the side effects from medication, and there's a pretty good response to it. There's other things I see like massage as well, and that works on stabilizing the muscle tone between all the muscles of the pelvis and the lower back. It works on those trigger points and helps to release those. I really love massage and chiropractic together. Acupuncture sometimes can come into that, making the flow of the energy and the lymphatics and the blood and all of that. That's a conservative management, but also think about just diet and exercise. Those are the big two that people miss. We're sedentary all the time, and we put that on our pets. So we see a lot of older pets that have hip dysplasia or dysplastic problems like that are due to them just not moving, not getting around. So that way they get too heavy and their hips and their knees can't support them. So a lot of times people will get with their vet to work on weight loss, which is great. The less gravity acting on those joints, the better they are. And then also, your vet may want to add supplementation. Adequane's fairly common. What it is it's basically, it's usually chewable. It can be injectable. Basically what it does is it tells the joints not to make inflammatory degenerative molecules. So it works on a specific protein, and it tells it to stop making inflammation, so that way arthritis doesn't occur. There are some side effects with that, but for the most part, fairly safe. I also see things like glucosamine and chondroitin sulfate and omega-3s. Those are awesome. They have the body building blocks that they need, so that way the body can process those, take them in, and hopefully use those building blocks to heal that joint. And then also think about just getting your pet active or doing stabilization exercises. A lot of times what I recommend to people is doggy squats. They just take their pet, they hold them here, and they basically hold them by the chest and make them go up, down. So that way the pet can build up those glute muscles that help to support the hip. There's some other ones I recommend as well, but that would be on a pet-by-pet basis. And then, moving forward, conservative management. What if your pet's already had a surgery? Well, I have some really great low force techniques. I have an instrument I use. It's called an activator instrument, and it gently taps the bone back into proper position through a reproducible thrust. It's not as, jarring as the manual adjustment with my hands. So I do that on a pet-by-pet basis. I need to evaluate your pet and what's already going on with them, so that way we can see what's going to work best for them. So I hope this answered a couple of your questions on some conservative things you can do for your pet, how you can recognize hip dysplasia, what the diagnosis looks like, and also some palliative things and if they may or may not work for you. I'm here to partner with you and your veterinarian, so that way we can enhance your pet's health. I want them moving at their best, so that way they can feel their best and live their best life. If you're looking to reach out to me, feel free to do so. You can find me on instridechiropractic.com. I want to talk to you about how we can get your pet feeling and moving better. Look forward to hearing from you. Have a great rest of your day. Bye.